I want to spend a few minutes talking about your immune system and how important it is and what we can do to support it. You see, God gave you an immune system to fight viruses, bacteria, and cancer. God did not make your immune system to attack itself, and that's autoimmunity. So what we need is we need a healthy, balanced immune system. Now, picture a teeter-totter, and a healthy immune system is like a balanced teeter-totter. On the one side, we have cell-mediated immunity. On the other side, we have antibody-mediated immunity, and in the middle is the fulcrum. And the larger the fulcrum is, the easier it is to balance. So let's talk first about the fulcrum. The fulcrum is your nutritional support of your immune system, and that are some key nutrients like vitamin D, vitamin C, magnesium, and zinc. So by having optimal levels of these micronutrients, we are supporting our immune system. Now, when we look at the two ends of the weight of the teeter-totter, cell-mediated immunity is what fights viruses and intracellular bacteria and cancer. And antibody-mediated immunity is for extracellular infections like strep throat. Now, if we start suppressing cell-mediated immunity, then antibody-mediated immunity starts going up. And if this happens over a long period of time, over and over again, now we have a very unbalanced teeter-totter, and the offshoot of that can be autoimmunity. So this is important to understand because it gives us a direction for healing. So what I do is I want to, number one, support the fulcrum and get optimal micronutrients that support the immune system. And number two, raise cell-mediated immunity because I don't want you to be at risk for viral infections and cancer. And I don't want you to be at risk for autoimmunity. So we want to balance that teeter-totter. So what happens to cause the imbalance? Either a deficiency of the micronutrients or things that suppress cell-mediated immunity. So things that lower this part of the immune system are certain viruses like Epstein-Barr virus. Mycotoxins is a huge one. Mycotoxins really suppresses cell-mediated immunity, and certain intracellular infections like Lyme disease will also suppress cell-mediated immunity. So if these things happen over and over again, pretty soon we have a very imbalanced teeter-totter, and then we get autoimmunity. And with autoimmunity could come an increased risk of cancer because that teeter-totter is so imbalanced, and this side of the teeter-totter, cell-mediated immunity, is what prevents cancer. So we don't want to be at high risk for cancer or have autoimmunity, and that's why we need that balanced teeter-totter. So things that will raise cell-mediated immunity will decrease autoimmunity. Three quick ones. Transfer factor. So transfer factor is made out of bovine colostrum, and it is the knowledge of it's a molecule that carries knowledge of the immune system and helps keep it balanced. Transfer factor can raise cell-mediated immunity by 300%, and that's huge. Another thing is peptides. Thymosin alpha and thymosin beta are very powerful balancers of the immune system. And the third thing is low dose naltrexone, LDN. LDN will raise cell-mediated immunity and is a very powerful force for immune system balance. Now, LDN is a prescription, and so is peptide therapy. But the transfer factor is a supplement, so you can get that without a doctor's prescription. That's brief information that's important to understand about immune system because so many of my patients have autoimmunity or are recovering from cancer. And so we want to do everything we can to support and maintain a healthy immune system.